Good morning, everyone. On behalf of ASCP, I'd like to welcome you all back to the Building Bridges webinar series in service of the CDC One Lab initiative. My name is Dr. Rodney E. Rohde, and I am Regents Professor and Chair of the Medical Laboratory Science Program at Texas State. I'm also the Associate Director of the Translational Health Research Center at Texas State, and a longtime ASCP member and current moderator of this particular series. We want to start by encouraging everyone to check out ASCP's website, where you can find out more about the free laboratory education and resources available through CDC One Lab and ASCP's One Lab grant. This webinar series highlights the diverse array of laboratory career paths and how exposure to formative experiences, often through collaborations and unique training opportunities, can help shape these career trajectories. We'd like to acknowledge that this resource was made possible by funding from the Centers for Disease Control. However, ASCP is solely responsible for its content, and the viewpoints shared do not necessarily represent those of CDC. Today's session I'm really excited about will feature 4 fantastic laboratory professionals across dynamically varied roles supporting public health laboratories who will share a glimpse into their career paths. As we all know, surveillance is one of the pillars and foundations of public health. Then we'll have a Q&A session and conclude with some reminders. We'd like to quickly share a few housekeeping notes for everyone. Lines will be muted during the session, so please add all questions for the panelists into the Q&A box, and I will relay questions at the end of the session. Closed captioning for this webinar is enabled for any interested parties. A link to today's recorded session and slides will be available on our website in about 2 weeks. Before we get started, we wanted to share a quick overview of the career map template that our panelists will use to present today. Education and work history will be presented on the left column, as you can see in this example. Career influences will be presented in the middle column, and on the right column, you will see a career advice quote that resonates with the panelist. With that, we'd like to ask our first panelist, Dr. Mary Rogers, to go ahead and introduce themselves and get started. Enjoy yourselves, everyone.
Thanks, Dr. Rohde, and it's a pleasure to be here today with all of you. My name is Mary Rogers, and I'm Associate Research Fellow here at Abbott, where I run the Abbott Pandemic Defense Coalition. So to give you a little bit of background about how I got here, I started out as a student in biochemistry at University of Wisconsin-Madison, and I would say that some of my early lab experiences when I was an undergraduate really were informative for the rest of my career. Primarily, I would say because I was trying to figure out what I wanted to do next as an undergraduate, and I started working in a laboratory setting, and I fell in love with it. But there's so many things you can do in the lab that it was kind of hard to tell what my next step would be. So I started with an open mind, looking at a bunch of graduate programs. And initially, I didn't think I could get into Harvard, but my advisor at the time as an undergraduate told me some really important advice that I use today. And she said, of course, you won't be able to if you don't try. So I would say that that kind of is my motto for every stage of my career is, of course, you have to try, see if you can do this. So I did get in, and I actually was the first graduate student in Priscilla Yang's lab in the virology department. And that's where I really learned how to do something from the beginning all on my own. I was doing things for the first time that had never been done because there weren't any other lab members to kind of build knowledge off of. And so I feel like that skill has also been really important for me throughout my career to really kind of take ownership of things and really understand that, I might not have an answer today, and that's okay, but I'm going to find out. And that's really important to keep in mind. So after I did my PhD, I went on to do a postdoc. I got my own research grant and things were going along well. But I got to a point where I felt like some of the work I was doing wasn't really having an immediate impact for patients. And I wanted to do more. I wanted to see how I could contribute in a way that could immediately have some important effect on people's healthcare. And so that's when I started looking at industry jobs. And I know there's a lot of them out there. And I know that as one of the panelists in industry, that maybe I could speak a little bit about what's unique about looking for an industry role. And I would say that, you have to go into it with a really open mind. You might notice that there's a lot of different job postings out there that aren't terribly specific about what you're going to do every day, especially if you're coming from another background where you've never been in industry before. It's hard to know what some of those keywords might even mean unless you've had more exposure to them. So I would say that while keeping an open mind, it's also really good to network and try and understand more about what some of those types of roles are like by learning from people who do them today. So I started doing some networking. I started asking people in my network, what kinds of positions there are. And I actually ended up talking to my graduate advisor who mentioned that there was a role that she thought I might be interested in. Of course, she's an academic, she's not in industry, but she had just been a reference for someone who had applied to that job. And she thought, maybe you should consider something like this. So I applied, I interviewed, and as I went through the interview process, I learned more about what kind of job it was. And that's when I really got excited about it. When you start to learn about the kinds of things that you can do in industry and you find something that you're passionate about, then it's an easy yes. And it's a fun transition to make, I would say. So I was delighted to learn about the role because it was a surveillance job, which I didn't know even existed in industry. And a lot of people don't realize this. So viruses in particular mutate a lot, and we have to make sure that all those mutations that exist don't have a negative impact on the performance of diagnostic tests. And so Abbott has had a program for 30 years now called our surveillance program, where we're looking to understand all those mutations in viruses so that we can then challenge our tests and design them to be able to detect any strain, regardless of where it's found. So we started out looking at HIV, and then we expanded to hepatitis and COVID, and we're continuing to grow from there. But the program also kind of evolved kind of around the time of the pandemic starting, when we realized that we also need to look at novel pathogens that we might not know about today. And that's how the Abbott Pandemic Defense Coalition was founded. And so I grew as a scientist at Abbott from starting out as a senior scientist doing that surveillance work, and then growing into a principal scientist and now an associate research fellow, where I'm managing these collaborations around the world where we're doing surveillance on a daily basis, going to work with patients around the world on 5 continents at all of our partner sites to understand what's making people sick today so that we can be better prepared with diagnostics that are needed for tomorrow. So I would say that some of the highlights, I've mentioned a couple of these from my career, but I would say that one of the really exciting moments for me was when, through our surveillance work, we found a completely new strain of HIV. So HIV has been around for decades, and you would think we already know everything about it, but we really don't. HIV still surprises us, and we came across a sample that, when we sequenced it, was unlike all the other ones. It didn't really match anything, although we knew it was in generally group M. So when we expanded our sequencing techniques and improved them and made a next generation sequencing approach for HIV that could reliably get complete genomes from low viral load samples like this unusual one, we were able to get a whole genome amplified and identified it as a completely new subtype, subtype L, which was a sample that matched only 2 other cases that had been found in public databases. So the first one was in the 1980s, the second one was in the 1990s, and then the one we found was in the 2000s. So even though this is a new strain that we found through our surveillance work, it's something that had been circulating pretty much since the beginning of the pandemic. So it was really exciting for me to really see in real time what it was like to discover something new. So that really drives me to everything I do today. I'm very passionate about this work. And I would say that the bridges that I'm focused on building today are really focused on these global collaborations that we have around the world. We're working with partners in countries all over, I mentioned on 5 continents, so that we can better understand what's circulating, because if a virus is in one place, it's going to be everywhere in a matter of time. Viruses don't pay attention to borders, and we know that they can spread quickly. I would also say that I had a really interesting approach during my graduate education where I took an interdisciplinary study. So I was in the virology program, but I partnered with teams across the river in Boston. at the main campus to do some chemistry. And I combined a mass spectroscopy approach with virology to understand what kinds of changes happen in people who are infected with hepatitis viruses at a metabolite level. So I think my common theme here is keeping an open mind, looking for ways that you can grow and include a collaboration that maybe wouldn't have been intuitive at first, but if you talk to people, learn about what kinds of strengths they bring and combine that with the kinds of things you're trying to tackle, then you can have a really effective approach in any stage of your career. I do want to highlight that we have a program here at Abbott. The link is here for our internship program. We do take people from a variety of backgrounds so that you can get experience in industry and see if it's right for you. I think it's impossible to know until you try it, and trying it out is a good way to figure out what type of a role you might be interested in, because you'd be surprised how a scientific background could actually be useful in a wide variety of roles, even if the word scientist is not in the listing. Um, we have people working in a lot of different areas who have scientific roles, and I could go on all day about that, but I'll kind of move on to the next section here. That some of the most valuable skills that I've really used on a daily basis are how I communicate about our science to a variety of different types of people. We know that people who don't have a scientific background also need to understand some really key concepts to make the right decisions, and that's a really exciting part of my job, is that I do that on a daily basis. I also stay organized, and if you can't find something that you did, then it doesn't exist. So you have to be able to find everything and keep things organized. And then I've always had a lot of questions, and I think that that curiosity has really driven every stage of my career, so that I can really push my own learning in every environment, and really get a better understanding of the science that we're doing and the insights that we're gaining from all the great studies ongoing. So with that, I'll pause and be glad to hand it back to you, Dr. Rohde.
Outstanding. That's a very interesting story. Thank you, Mary. And next up, we will have Hans DeSalle, who can introduce himself and carry on.
Thanks, Dr. Rohde. And thank you all for having me here. So I'll wait a little bit, my slide to get put up here. But oh, there we go. So I similarly, I guess, started as a biochemistry undergraduate student out at UC San Diego. I honestly didn't know what I wanted to do. I knew I liked science, so I kind of went that route. I started as an intern at a small biotech company out in San Diego called Receptos, and I ended up staying there for 8 years. Just slowly, I would say probably really developing my foundational laboratory skills, and that's, I think, the best thing I could find out of my industry work there. Um, I honestly didn't find industry research that interesting, mostly because I really enjoyed programmatic work. So after 8 years at Receptos, I left and joined an NGO in India. After about a year there, what I decided was just having a purely biochemistry background wasn't really enough for me to, I think, be the most effective scientist I could have been in an NGO kind of world or an NGO mindset. So I went back to grad school and I got my MPH at Tulane University, and I ended up staying at Tulane for my doctoral studies there. And you can see I wrote 2016 to 2023 graduate researcher, but this really encompassed quite a bit of different opportunities in my experience. And I think really my big takeaway of my career path, which has been very, very non-traditional, was I jumped at any opportunity that was available to me. So I worked with an NGO out in Rwanda doing more programmatic and more monitoring and evaluation and impact evaluation research, completely opposite of my laboratory research, foundation that I had. I ended up doing my doctoral studies in bioinformatics, working in Chagas disease. So I moved completely from, non-infectious disease to infectious disease now, and a parasite I hadn't heard of before joining Tulane University. Um, I worked in Ethiopia doing lab capacity development, and that again was primarily not really science related. It got me a lot more involved in how to create a budget, how to ship, how to ship machinery, how to ship supplies, how to ship, samples, things like that, which really I think culminated in my current position at the Center for Disease Control. I'm actually stationed at the dengue branch down in Puerto Rico. And here, what I found is this was really the perfect blend of everything I've really built up to doing. It was a combination of doing laboratory research and laboratory science, but also, working with other entities, working with other jurisdictions, working with local and state and territorial jurisdictions to try and increase, in my realm, dengue lab strengthening, dengue lab diagnostics, dengue surveillance. And so really when I think of the formative experiences, my laboratory career, what I think about isn't really a single experience, but more of the culmination of these experiences. I think having done so many different and really disparate, having had these disparate positions, what I've come to become is, just I've been exposed to so many diverse roles and challenges and languages that now I can really communicate with all these different roles and different people, and different jurisdictions and everything like that. And I think I really have to give a lot of credit to everything that I've done up until this date to getting there. I one of the more projects that I'm really proud of here at the dengue branch was capacity building out in the South Pacific. So I worked really closely with American Samoa and Hawaii, trying to build their dengue surveillance capacity out in those areas, which is, fairly remote islands out in the South Pacific. And it was a blast seeing a slow building of collaboration and strengthening over time, right? These were multiple deployments that we worked together to eventually build up the first FDA approved diagnostic testing in American Samoa for dengue. Um, so when I think about, I guess, how I build bridges, and how my career has really led to that, I think a lot of it has to be with the cultivating collaboration. And I really again have to, you know, look at all of my experiences and how every one of those experiences has given me something that contributes now. Whether that was my foundational laboratory skills, literally just learning how to pipette, learning basic laboratory assays, these kinds of things like that. Thanks for the shout out on the shirt. Got it in Samoa as well. But uh, in addition to that was all my programmatic work. I learned how to kind of speak epidemiology in that language. All my bioinformatics work really taught me how to use a computer, right? How to do any sort of data analysis, these kinds of things that at the time I didn't consider myself I was going to end up being a bioinformatician, but now that I have those skills, I definitely find places to use them. And it allows me the ability to speak with all my data scientists and my IT folks here who are also, huge parts of everything I do. Another thing, and I think as a whole, not to shame the entire industry or anything like that. I think laboratorians are generally afraid to share their stories and their experiences, and I think that's something laboratorians can do a lot better in order to also just kind of let people to know what happens in the laboratory. As Mary mentioned, it's not just doing science at the bench. It's a lot more of, our interactions, lab strengthening, surveillance, these kinds of things that I think a lot of people just think of laboratorians as, people on the bench pipetting liquids, right? And I think we're more than that. And it's really important to share our stories, inspire these connections, these things like that. Um, Again, I'm very big about encouraging open dialogue, fostering mutual support. I love working with my EPIs here at the CDC. I find myself very close to them, and they bring a new perspective into surveillance that I see from the laboratory side that they don't see, and vice versa. So two opportunities I really wanted to highlight for everyone was the Laboratory Leadership Service Fellowship. That's the one I'm in right now. It's open for any doctoral um, anyone with a doctorate degree in the United States who's really interested in public health laboratory research, and additionally kind of being leaders in public health laboratory research. And I think that's a big thing too, because that's more than just science. That's things like understanding how to communicate with people, understanding how to communicate to different and diverse audiences. Things like emotional intelligence, knowing how to, resolve conflicts, knowing how to navigate paperwork. These kinds of things we don't consider as scientific skills, but when you enter into a leadership role, those are skills that you do still need to have. And another valuable skill that I'd really encourage people to look at is data analysis. I think oftentimes, again, in the laboratory, we kind of are siloed into the science that we forget about the actual analysis parts of things. And I really think, don't be scared. There's a lot of, free classes for R, Python, these kinds of, with the addition of AI, it's made things a lot easier as well. And these are things that I think we need to really lean into and become better at. So that's really all I had to share about my experience. And, feel free to follow up with me if you'd like to discuss anything more. Thank you.
Thanks so much, Hans. Two things resonate with me from your conversation: science communication and data analysis, so critical in our world today. So thank you for that conversation. Next up is a good friend and colleague of mine that I've known for a few years, and I'd like to introduce to you Travell Mason. Welcome aboard, Travell.
Thank you. Thank you. Thank you. I'm happy to be here. I will start with our audience, asking them to help, kind of imagine joining a uniform service where you actually control your career trajectory, responding and deploying to public health emergencies and natural disasters, working at premier public health agencies, and working alongside some, of the smartest and dedicated people in the world. I'm Lieutenant Commander Travell Mason. I'm with the United States Public Health Service Commission Corps, or you can just call me Travell or Mason. I respond by both. But I'm also currently stationed with the Centers for Disease Control and Prevention in their Global Health Center. So much like the previous panelists, Dr. DeSalle and Dr. Rogers, most of my formative experience, not most, but some of my formative experience started in school and undergrad. And I'll actually take it back to my internship at St. Vincent's Medical Center before I landed a position. Uh, During that time, there was in the hematology lecture, I remember it vividly. The hematology lecturer, Dr. Patrick Monahan, went around the room after his lecture and just asked everybody what were they interested in, what were they going to do next after they move on. And as he went around the room, I had my answer ready, of course, and he got to me and I said Peace Corps. I was really interested in the Peace Corps at the time and leveraging, what I learned, however that would look like in the Peace Corps. And he said that sounded good, and also, maybe consider USPHS, United States Public Health Service Commission Corps. So I took that little bit of advice back with me in www.usphs.gov, and looked at what he was talking about. And so so come to find out as well, he was aligned with the Commission Corps and the mission and values because he had a wife that retired '06 captain, officer rank captain with the Commission Corps, and he got his exposure obviously through her. So I took that little bit of advice back with me and did some legwork and submitted my application. Saw that the mission aligned with what I wanted to do and what I liked, and serving the underserved and responding to public health emergencies and leveraging my experience in my career and my education in my own way. So submitted it, and of course, with all government things, I waited and I waited. Moving on, I obviously had to work, right? Graduated and went on to work in the meantime. So I joined the Mayo Clinic in Jacksonville reference laboratory located there, where I got exposed to a lot. Got a lot of experience through obviously serology, immunology, micro. I was working at nights, mind you, too. So I was really, all over the place, chemistry and for my folks that work nights or did work nights. And as you can imagine, what that looked like. So eventually, year and a half goes by. I do get notified that I can move forward with my application. So, you do your boarding and your medical boarding, professional boarding, all that good stuff. And again, one of the uniqueness about the Commission Corps is that we pursue our own assignments, and the onus is on us. And you might hear maybe later from our fellow sister services, the Army and Air Force, that it may be a little different experience, but for us, that looked like for me specifically one of two things, primarily with the work that we do in the lab, and that meant either opportunities with the Indian Health Service, being an officer stationed at the Indian Health Service, or an officer stationed with the Bureau of Prisons, which under the Department of Justice, but also having a laboratory presence. There's others as well, but those were the main ones, especially coming in fresh and new. So the Indian Health Service resonated with me, serving the underserved again, being able to immerse myself and culture. So I took on a position there in Arizona. It's not on the slide, but it's an Arizona location, about 2 hours east of Phoenix, on the tribal land there, or also known as a reservation. So got fully immersed and engaged in the environment there, the culture there. Loved my time there. Was able to go also, in addition to working in the lab, you know expand out into the community. When you're working in an area with resource stricken, or the lack of resource, if there's people willing to do it, they're willing to take you on and say, hey, go for it and do it. So was able to do things with their Boys and Girls Club, with education in their schools there, with stuff like similar to this, obviously, to a younger crowd, about how the lab and the opportunities within the laboratory that they may not have heard of otherwise. So during that time as well, I was able, looking for what opportunities could be next. And I've always had a minor in public health during my undergrad, but I was interested. That opened the door for me to also pursue a master's in public health. So during that time of school or working and serving at that location, I was able to obtain my master's in public health. And I think that opened the door for my next role with the FDA, Food and Drug Administration, again, still officer, but assigned to a federal agency. And having, an extra layer of, sometimes folks may not understand, what we do in the lab, but also having something extra to show that my skill sets are continuing to grow and to increase. So I joined the FDA after my time with the Indian Health Service. And I was given two options then as well. And I'm always thinking, ahead, or where would I like to do and what type of role would build me in the way that I would like to, the experiences I would like to take. So those two options were the food program, investigator inspections with some of the largest firms in the world, within the U.S., and or the biologics program, which does vaccines and does blood banks and other things. And so one obviously aligned most closely with my laboratory background with biologics, but the food was different. And uh, I would be able to uh, be exposed to international, or be qualified to do international foreign inspections later. So my end in sight was, getting more exposed to the global health and that aspect of public health at the end. So I decided to take that route with the food inspections, and that turned out to be another great and fantastic experience. I can recall a time where my lab background came in to very to use. Obviously, that's my foundation. I recall two supervisors, mine and another, were looking and scrambling to find a fresh, new, bright-eyed, bushy-tailed investigator that was qualified and competent, obviously, but also willing to be suckered in for an assignment. And this one specifically, they asked, "Hey, Travell, do you have micro experience? Do you have any experience with micro?" I was like, yes. Depends on what you mean by that, but for the most part, yes. What they were looking for is with the Food and Drug Administration in the food program, some of the assignments contain, I guess, activities that include what they call environmental sampling, which is basically going into a firm, a part of the investigation or inspection, or especially if it's an outbreak investigation, is sampling with swabs or sponges or sterile objects before you sample, meaning obtaining, a smear, not even a smear, and that's not the right word. That's going back to blood smear, but just gaining a sample of the environment, meaning the floor, the wall, the paths of infection where you think you see there could be contamination, and grabbing a sample through whatever medium, and kind of similar to anything else, putting it in something to transport it and transport it to their food lab and to test it to see if there's pathogens, and if you can determine the route of contamination. Anyways, turns out I don't think the micro experience was, I think if I would have said yes or no, it really didn't matter. They were probably just needed a body, but just by saying yes and being a part of that particular experience expanded my roles within. This was in California, so I was able to then leverage that to join the California Food Emergency Response Team within FDA, and was able to be a part of some of the really, really big cases and assignments within on that region, ranging from kratom, which is a dietary supplement, to fresh leafy greens, and testing for things as E. coli, salmonella, listeria, list goes on. Tying it to the foreign and global health aspect, I was able to also become qualified to do inspections in Peru and Thailand, and I really, really enjoyed that experience. So from there, again, constantly looking to expand my skill set. I went on to the Center of Tobacco Products, still within FDA, but with more of a project management focus, and really heavily process management, project management, and get some education with them through FDA's own internal training programs, and they're fantastic, if I will say so myself. What you won't see on the slide here is during that time, this was actually in Maryland, and I'm it's also one of the aspects of being a commission officer with PHS is we have to keep our laboratory qualifying degree, keep those current, keep competent in that area, because you often deploy in those roles as well as others, but you deploy in those roles. So a lot what you in the background is part-time work at hospitals. In Maryland, it was Adventist Healthcare in White Oak Medical Center, if there's anybody that's on the line from Maryland, and Silver Spring. And so keeping my skills abreast and current during that time, as well as doing the work that I need to do day to day. So maintaining those practice hours and those competencies. So really from there, project management under my belt, some of the FDA exposure, everything out, as well as the foundational work with the medical lab, and keeping that medical lab background and expertise current, led me into my role now with the Global Health Center, where really there's a lot of things, and you'll see my current responsibilities noted here. But it also includes, I want to kind of emphasize the articulating the impact part. So articulating our agency's impact on global health, surveillance work or definitely laboratory work, technical expertise there that we have with CDC, but as I'm sure Dr. Tersal can speak to, but really being able to showcase that and continually to articulate that. It's both a skill and something that's totally needed consistently. The shaping that message and the work that we do and rehoning that. So bringing it back to the slide here, how I bridge with the lab community. Obviously, I stay connected. One of the things, one of my hats I wear within the Commission Corps is the chair of our professional advisory group. We stay well connected. We find ways to develop each other and ourselves, and we support each other in our deployments or during whatever times that we need. Sharing experience and opportunities similar to like things like this webinar. Building Bridges has been really good, but others in podcasts and making myself available and to conferences and sharing those experiences and opportunities there. And one of them is the joint annual meeting. I think might be happening sometime this month. Obviously, I'm not going, or did happen, but I'd rather be here with you guys anyway. Lastly, or at least next is opportunities of interest. I'll actually skip the first one and go to the middle one, the Foreign Service Regional Medical Laboratory Scientist. One of the things I wish I would have known, or in addition to knowing now, is there's so many different ways that medical laboratory scientists can be involved with on the global aspect, and that's one of them. The Department of State has obviously embassies, and they employ MLS through the regional medical laboratory science position. And every time I see that announcement go out, I always think, man, if anything ever changes with where I am with the Commission Corps, I'll jump on that real quick. But so that's one opportunity, and I don't think a lot of folks know that's really interested in the global health aspect. Obviously, they're with the State Department, so there's some citizen requirements, U.S. citizenship requirements. More so, where I'm thinking about next is the College of Artificial Intelligence. Seems like a buzzword right now, but when the government starts talking about it, and I'm sure they have been for a while, but that piques my curiosity to further to expand, and maybe that's something you look into as well. And I think I did see something in the pre-slides about that, so I'll be asking for information on that as well. My career trajectory with the Global Health Center, Global Health at the CDC and Commission Corps. We're obviously, for folks that are interested, we're obviously, if you're qualified, we invite you, but for me, continue to expand those skills to where my eventual landing spot, hopefully, is a country offices within the CDC. So whether folks know, we do have quite a bit of a footprint globally with the CDC, and with my previous agency, the Food and Drug Administration has offices globally. So there's interest there. Happy to speak further to that. So I did not time myself on this one, but hopefully I did it as brief as less than 10 minutes. But I will kick it back over to you, Dr. Rodi.
All right, thank you, Travell. Certainly a interesting career path, and I love your comment about saying yes to things. I always try to get my students to think about that, to experience more than just what they think they're going to experience within school or something. Next up is Kieran Liverpool from the United States Navy, and I'm looking forward to hearing your talk, sir.
Hello, Rodney. Hello, everyone. Can you hear me?
Yes, we can.
Yes, we can hear you.
All right. Yeah, so I am Kieran Liverpool of the United States Navy. A little background about myself. I was about 19 and I didn't know what to do. And I always liked medical. I was interested in medical, but I was introverted and I did not really like patient care that much. So, I decided to to enlist in the Navy at first. I heard about the medical lab tech profession, and I decided to give it a go. I became a technician in about 2010. I worked my way up. I was stationed in places like Naval Hospital Guam. Phenomenal experience. I love being overseas. I even got stationed with the Marines, was performing lab tests out in the field, even deployed to Afghanistan, which was a interesting experience. But we contributed in saving lives, in testing blood, providing it for combat casualties, things of that nature. I eventually got my MLS certification. I became an instructor over at the medical education training campus in San Antonio. I absolutely love Texas. I wasn't sure how I'd be as an instructor, but I loved it. I mostly taught in the chemistry section. It was hard. It was a lot of work. Preparation was the key, but it was a great experience. I eventually got commissioned, became a naval officer. One of my first tours as a naval officer was at Naval Hospital Portsmouth. I was a division officer. Portsmouth has a big lab, so they split us up by the divisions. So I was the division officer for core lab. It was a steep learning curve, but like everything else, you have to put in the work. You have to be interested. You have to develop a passion, and yeah. After that, I came in one day to work and I got an email saying like, hey, there's a lab in overseas that I can't tell you guys where I'm at right now, but hey, it's an opening for a department head and you're up. Said, okay, had to pull up my bootstraps, got my affairs in order, and I went overseas, and now I'm a department head for a laboratory overseas. Some of the things that shaped my career. I was part of the CLP, ASCP CLP. I absolutely love that experience. That's my first time being in a professional laboratory network where I met phenomenal individuals. It was great networking with them. We got to sit down, plan, make important decisions. There were peer reviews, things of that nature. Absolutely loved it. And we used to meet every year. It's just a phenomenal experience. Back to part of me being an instructor, they used to tell us one of the best moments of being an instructor is when you're teaching and your students get an aha moment of a complicated principle. And those aha moments used to happen to me all the time, and they were just as effective. Like you're teaching something, you're like, hey, I'm now seeing a different aspect of this. So it was great. How I plan to build bridges. I plan to continue with the ASCP ambassadorship. Every time I've reached out, I've always gotten great support. I've always gotten great resources from them. I've learned over the years, working in the lab, just being a professional in general, that networking is one of the true keys to life. Okay. The more you network is the more successful you're going to be. So I've stayed in contact with some of the ASCP lab professionals, my colleagues. I've stayed in contact. I've received phenomenal mentorship. I've helped in mentorship, mentoring people. It's things like that, and I've just kept learning and growing along the way. Recruitment and retention. There's no secret that our community is kind of suffering from manning right now. I've worked in, well, I call it civilian labs, when there's not enough of the local population to work, so we've had to get overseas personnel to keep the lights on in the lab. For me, it's me having passion, me having passion of work in this field. It hits me hard, but because it puts an extra strain on your staff. So I'm an advocate of trying to recruit people and also trying to retain people. Okay. Opportunities of interest. I have flirted with the idea of getting my PhD to probably become a director somewhere. I've been in the Navy 18 years, and I'm coming up on a retirement maybe in the next 2 to 7. So I am looking to transition into my next civilian career. Operations manager, I like that aspect. I like coordinating, engaging with folks, solving problem. It seems like half of my day and my daily job right now is solving issues and putting out fires. And deep down, I kind of like it. I'm also interested in being in the Council of Laboratory Management and Administration. That's a large chunk of my job right now, and I would absolutely love to engage with individuals such as myself to learn and network, and just continue to grow. Skills that I've learned along the way that I think is very important: leadership. Folks need guidance. I myself need guidance. People need mentorship. People need to grow. People need to feel wanted. They need to feel appreciated, and I try to provide that to my staff. Being where I'm at, and also being at other isolated places, you have to be resourceful. If you're not resourceful, your lab is gonna suffer. Patient care would suffer. So you have to be resourceful, maintaining certain relationships, talking, being up at 12 at midnight, trying to talk to vendors, other companies, things like that, trying to get supplies in, just doing whatever is necessary. So I pride myself in being resourceful, and it goes hand in hand with being with coordination. And my quote, taking extreme ownership. If for me, I'm a department head in the lab. If a discrepancy happens in the lab, it's not on one of my juniors, or it's not essentially, I have to take responsibility for everything. All right. If a discrepancy happens, I have to look in the mirror and say, hey, did this person receive the necessary training, right, that it was necessary for them to complete the mission or the action? Okay. And I try to empower my staff also to feel the same way, like, hey, if you're in charge of the supply, and take ownership of that area, right? Take ownership of that area. If something happens, if a discrepancy or mistake happens, say, hey, this happened. Okay, so I'll learn from this, and I'll try not to make the same mistake. I do think if people approach life every day with that mentality, things will be better, and they'll just continue to grow and learn from their experiences. That's all I have today.
All right. Thank you, Kieran. Interesting career path. Next up is Gunnar Conroe. Looking forward to hearing your talk, sir.
Thanks, Dr. Rohde, and good afternoon, everyone. Like my colleague Kieran there, I kind of backed into the medical profession, and I have to say, I owe that to my father, who was a Marine. I can never say former Marine, because once a Marine, always a Marine. On my 17th birthday, it was a surprise birthday party, and he had a recruiter at my birthday party. And it was a Navy recruiter, and it was December, and by February, I was signing the line, and I haven't looked back since. And I started out as a Navy corpsman before transitioning over to the Air Force as an enlisted member. And the career field that was picked for me was medical lab. And I had no clue what I was getting myself into. So I know in my jobs over there, as far as the year goes, it starts in 14 and goes to 24. But I've been serving in the Air Force laboratory community since 1988. So I've had numerous experiences from the bench level to the section supervisory level to department heads. And now I serve at the Defense Health Agency at the Center for Laboratory Medicine Services, which you're like, okay, big deal. But what it does, or what we do, is we're the CLIA representatives, otherwise CMS for the DoD. We have been given to execute CLIA law for the Department of Defense. And because we serve in austere locations and we sometimes have to do some bizarre things, we run our own CLIA program. It's called the CLIP program, and that's what our office does. But as the Department of Defense has morphed and as the Defense Health Agency has morphed, we're turning more into a lab program office and kind of directing operations for laboratories around the world. You can see some of the jobs that I've held. Right now, I'm currently the Air Force Director. It's a joint office. So we have Army, Navy, and Air Force in the office, and we share the directorship role. I served as a director from when I got on board in 22, and now I've turned that over to my Navy colleague, and I'm the Air Force Director and then Chief of Lab Operations. So those are those titles. One of the exciting jobs I have, and it doesn't happen a lot for laboratorians, was to serve as a commander at the 17th Healthcare Operations Squadron at Goodfellow Air Force Base in Texas. And I never saw myself when I was, working the bench that I would ever be a commander of a squadron, of a multidisciplinary squadron that had primary care, mental health, physical therapy, logistics, readiness, laboratory, radiology, pharmacy. But wow, what an experience. And I can say without a doubt that a lot of the leadership traits that I had picked up along the way, or skills that I had picked up, were developed in the lab. It was a great correlation. We've heard about data analytics. We've heard about administration. But all these things were, I was exposed to throughout my career, which I think really led to a successful command tour. And so grateful to my community that formed me. And then it also opened my eyes to, just how we as laboratorians partner with other sections in the hospital and clinics. We kind of think that we're isolated, but we touch so many functions and we touch so many people's lives in ways that we don't even know. So that was great. And it was great as a commander to be able to advocate for the laboratory. I was a commander during COVID. So, trying to bring sanity to that mess, and providers wanted, to bring on these tests. And I was like, well, these tests aren't really good. We need to find something else. And then to work with our public health colleagues was phenomenal. And then you can see I served as a deputy director, which was when I was coming up to the officer ranks, because I commissioned in about 2001 after getting my degree and certification. The job I really wanted was to be the deputy director in our office. And so I got that opportunity after completing Air Command and Staff College, which is a master's level program for Air Force officers. And had a great time, had great leaders. They gave me a lot of space to try things and to work on different committees. And again, what an experience to be able to see a whole healthcare organization, not just a facility, but the whole organization, and how you work with different agencies within the federal government, whether it was the FDA or whether it was health affairs or even our line partners in the services. So yeah, if we go on below that, I didn't want to bore you with all that. So, but if you have questions, I certainly have time to answer. I kind of touched on what some of our current responsibilities are. We have over 1,000 laboratory sites throughout the world, and it could be a laboratory that's in a backpack in some austere place. It could be on a submarine, could be on a ship, could be on a CCAT team on a C-17 that flies air medical missions. Could be in a hospital, in a clinic. It could be anywhere. And trying to tie this into kind of the surveillance role, we have a lot of surveillance laboratories in the Department of Defense, and having those folks prepped to be able to go from surveillance to clinical testing is key. Key for the safety of our forces, key for our outreach in host nations. Remembering the Ebola outbreak probably around 14, 15 in Africa, being able to stand up laboratories quickly to be able to not only test our forces, but to be able to test the locals and have that outreach is very important. And then, as I said, our office has morphed, and now we're coordinating and building efficiencies throughout the defense health laboratory network, working on projects to consolidate pathology services, bringing on digital pathology, working on getting the samples to the right spot where we can have large automated lines that are already in place. And then, of course, one of our newer projects is trying to retain microbiology services and testing within our Department of Defense hospitals. It's hard to find microbiologists these days. And the easy button is often to send it to LabCorp or send it to Quest. And when we do that, we miss out on all that great epidemiological data that we need, because we have folks that come back from overseas or are exposed in different areas of the world. And being able to retain those samples and being able to have that data and then sequence different bugs, very key to our mission as military members. Formative experiences. It was the Air Force MLT program. I was not a strong student as far as science and math was in high school, but in the lab, it clicked. I don't know if it's because it had a direct application, but the science became something I was interested and passionate about. And I found success in that program. And then I want to say our instructors instilled that sense of pride in what we were doing and how important we were, that we weren't just an ancillary service. We were an essential service to make sure that our providers had the accurate information at the right time on the right patient to make the right diagnosis for the right treatment. And it all started there at the MLT program. So thanks, Kieran, for being a great instructor. I still remember some of those great instructors I had, and what an impact they made, and how they impressed upon a young 20-year-old how important laboratory testing is. The lab section supervisor duties, that's where I made a lot of mistakes. But again, it pushed me into quality control. It pushed me into supply management. It was managing people for the first time. So those formative experiences as a supervisor over a section, or even as a non-commissioned officer in charge of a laboratory, having to work with other departments to get the mission done were key. And then I already spoke about being the deputy director. That was a highly informative, a highly formative position. That put me on a different track as far as where the Air Force started to place me into command positions right after doing the deputy director job. How do I build these bridges? We've already heard it already. It's relationships. It's relationships with lab leaders, our vendors, as uncomfortable as that can be sometimes. And you always feel like your sales pitch, it's staying in contact with them, because they're the ones that are pushing the technology out and understanding what's coming on the horizon. or how can we optimize what we currently have? And then expressing our needs. Hey, we need this to do that. And then always staying in touch with our operational staff, those folks that are getting the job done day after day after day, working with limited resources, labs that are having a hard time getting support from, executive functions, whether it's for staffing or resources or, hours of operation. Always want to stay in touch with those folks. I put strategic sessions on it, and that's strategic sessions, whether it has to do with laboratory or it has to do with healthcare at large, or even volunteering to be part of a strategic session for the department that has no relation to the laboratory. It's great to build those bridges and to hear how folks perceive what lab services do. So that I build bridges that way. And then I think several folks have already mentioned, being present at educational events, leading educational events, and then volunteer opportunities, with either our lab societies, or even with military societies. Opportunities of interest. I list ACHE, and I'm sure there's probably some cringe factor out there because they're like, oh my gosh, we're going to talk about administrators. But I had a mentor tell me, because soon after I had finished my degree and got my certification and was considering what path I was going to go, whether I was going to become a lab officer or I was going to become an administrator. And my lab boss at the time said, Gunnar, I'm going to tell you this once. He said, laboratorians can be administrators, but administrators cannot be laboratorians. And he was so true. And like I already alluded to, my command experience, how important was to understand what our administrators do, because they're connected to finance, they're connected to our logistics. So anything we can do as laboratory leaders to understand that world and understand that language, I think goes a long way. So if you're thinking of what's something I can pursue that can really maybe help my trajectory as far as my career, I would highly recommend, peeking over the fence at what some of our administrators are doing in the societies they belong to. Currently involved in Johns Hopkins healthcare leadership courses, strategic leadership courses. Those are available. And then I had the opportunity to attend the global health courses that are provided by the Uniform Services Health School. Obviously, being military members, as I've said already, we're all over the globe. So having that exposure to the needs of host nations and nations that we're trying to partner with, or nations we're trying to build relationships with, understanding the things that they're facing, understanding the disease threats that are on a horizon. So anything you can do in the global health arena, I think would be valuable to your career. Valuable skills, active listening. And I put this out there because I probably didn't do a lot of that early on in my career. And, I talked first and listened second. And I had a boss that I think he realized that, and in his way would bait me into discussions where I would blast off, and then I would have to be humbled after that. And I don't know, maybe it's a product of age or experience or wisdom, whatever you want to call it. But active listening, to hear the concerns of folks, to hear what the concerns really are, because I think oftentimes we start formulating answers or solutions without really listening to what the problem really is and being able to define that problem. You have to listen. Communication, we've already mentioned it. I just want to highlight emails. Get good at communicating via emails, keeping them short, concise, and clear, and beware of tone and how things may be received, because so much of our communication is just done through email that we've really got to be good communicators in that environment. And then being able to provide the so what. Oftentimes we don't, our opportunities to get our message across as laboratorians is very brief. So we have to use that time wisely and get to the so what. So communication. And then the last one is strategic reflection, scanning and planning. You have to take that time. Whether it's weekly or monthly, is to step back from the day-to-day grind and reflect strategically on where you want to take your department, your organization, and scanning what's happening out there, what's going to influence, what things can I control, and then actually planning to meet the challenges. The quote, it's not about me. I'm second. So many times we get wrapped up in our projects, and they take our personality and they become personal. And ownership, yes, extreme ownership. I love that. I love that book. If you haven't read the book, Extreme Ownership is really good. Written by a bunch of SEALs, but still appropriate. But don't make the work about you. Make it about what you're doing, what your mission is. And remember your second, your folks around you, your bosses, your patients. It's about them. And if you put yourself in that second place, you can meet their needs and make sure you're a healer and not a hurter. And in the words of Forrest Gump, that's all I have to say about that. Back to you, Dr. Rode.
Thanks so much, Gunnar. I love those pieces of advice. I'm reading a book right now about public service, just in any field, and it's a very thematic book with what everyone here is saying. So I just appreciate all of your experiences. I think the common theme really between all of you is diversification, communication, globalization, and really not saying no opportunities throughout your career, because without stepping through that door, really none of us become leaders or administrators or whatever your role is going to be. So we have about 15 minutes or so for Q&A. I think I'll start off at the beginning a little bit, because a few questions early on were about Mary's role in pharma at Abbott, and kind of talking about other kind of non-research public health related opportunities in industry. Do you have any thoughts on that?
Yeah, so first, I just want to be really clear. I work in diagnostics, not in pharma, and they are very different environments. So my opinion isn't based on any experience in pharma. So I would say that research is a primary way you connect in industry to public health. Identifying the needs for a test and that kind of research, and how tests can best be used to improve people's care, that kind of research is really key for connection to public health. But beyond research, I would say that what we call operations is a way that you can also connect in a less scientific way, but having a scientific background is really important. So those are things like our quality system to make sure tests are performing the way they should. Anyone involved in the logistics chain, there's, believe it or not, scientists in that area too. We also have people in the product development side. So after we've done all the research, we have to actually develop the test. And that's another area that's a great connection to seeing an impact of your work in public health. So really the sky's the limit. There's a lot of different types of roles. Regulatory, I didn't even mention that one. There's plenty to explore that are related and relevant for public health.
Yeah, I would agree. Even in my background, which is hybrid between public health and academia, many of my students, and this speaks to the military involvement too, many of my alumni end up in roles in industry, usually as specialist kind of troubleshooters, implementing equipment. And it really resonated me with Colonel Conroe about, you know, we can do the roles of some things, but not many people can do the role of laboratorians. And I really agree with that because even my alumni will often end up in IT, they'll end up in troubleshooting, and they understand the background of medical lab, public health diagnostic testing, where that you can't pick up that skill going the other way. So I really appreciate that comment. Maybe a question for the military individuals. I have some questions here about recommendations for civilians seeking employment with military-based laboratories and kind of that dynamic between military and civilian employees with some of your experience. So maybe we can start with Mr. Conroe, and then we'll kind of file through the military individuals.
Yeah, so our civilian workforce we can't do it without them. And that's, and unfortunately, I just full disclosure is oftentimes the way the GS scale is, they're not compensated as well. In certain locales, they can be because there are certain programs where we can match salaries. But we utilize our civilians. They're in our research labs. They're in our reference labs. A lot of times they're the continuity because we move around all the time, 2 to 4 years. And, our civilians oftentimes are section supervisors. There are experts. So yeah, they're invaluable to our operations, and some of them actually deploy. You can deploy as a civilian into to overseas locations. But yeah, there are opportunities. We've had some positions that are actually the lab manager, the OIC, whatever you want to call them, department head, have been roles that have been filled by civilians. And yeah, love them. Yeah. um, you can look on USA Jobs if you're looking for a job. If you want to join the military, as a green suitor or blue suitor, you can contact me. I can put you in contact with the service consultants. If you're a pathologist, there's opportunities there too. We do have civilian pathologists on staff, and then we're short pathologists, so you certainly can join us if you want to go that route.
All right. Any other thoughts from Kieran or Travell on that particular question?
Hey, so I've been seeing a lot of questions about some of the civilians potentially joining the military. What I will say is that if you're hoping to guarantee that you're going to stay in the lab field, you probably need at least your MLS, right? It starts with contacting a medical recruiter, hopefully Navy medical recruiter, and it starts from there. And you could potentially, if you qualify, you could potentially come and get commissioned as a naval officer.
Travell, do you have any other thoughts on your pathway?
Sure. Yeah, and this is kind of the uniqueness again with our service with the United States Public Health Service Commission Corps. We actually work alongside similar to what was stated um, from the Lieutenant Colonel with the general service civilians, and to the extent that we're the minority at most of the agencies, minority in number of the uniformed officers, the most agencies that we're stationed at. But I will say I'll also echo that the GH pay scale, the GS pay scale may not reflect not be too appealing to a lot. of folks, but depending on the agency, there's other incentives. So I'm thinking of the Indian Health Service has a loan repayment program. So obviously, depending on where you are with your career and how your education was, but there's incentives that they'll pay. I think I took advantage of this. What, $40,000 a year, or maybe that was within 2 years. And it depends on what profession, but specifically for the medical laboratory science that's available to help offset some of that. And depending on the agencies, there's other incentives as well. The Commission Corps as well. Similarly, we commission officers, obviously, it's in the name, and with qualifications from the NACL's accredited programs and the degree in a BS in a clinical lab profession and certain other medical and board requirements, similar to the other sister services as the Navy and Air Force. But yeah, happy to point folks in the right direction of that. But to your question, yeah, the civilian workforce is needed as well. So I always have to put on a suit or a uniform to contribute and serve the underserved. The GS General Service pays for that pathway is still needed and very much very, very.
All right. Thank you all for that. I know there's always some interest in there. Interesting. I'm actually at the ASCLS Lab Jam right now. And one of the vendors is the Indian Health Services here. And I have two students who are graduating in August that are both Native Americans, and they are already talking to them. So if you're interested in that kind of specialized role, I know Travell knows there's a great need for that across, many areas of the country that often are underserved and need those roles. So, one of the great things about this process with building bridges and bringing in so many diverse speakers is that it allows educators and others that have influence in students' lives to just show them the opportunities, right? One of the great things about the slides that our speakers are sharing, and I hope that you all will take advantage of, is to inform other people about these opportunities, because I know as a first-gen college student, when I went through school, I had no idea what medical lab was. And it actually ended up paying off because I ended up working for public health labs first. And then I kind of went back into the medical lab. So there's just so much out there that many people just don't understand early on in their career. A quick question for Hans, some interest in careers within the CDC. I know it's an interesting time at the CDC right now and looking at public health, but do you have any perhaps hidden or unseen advice or hints for students or new graduates, perhaps, or those looking to transition their career into public health? Do you have any thoughts on how they might go about that right now?
Yeah, I definitely think fellowships are probably, I mean, in terms of the hiring freeze, I know I saw a question about that. That's, going to be way above the level of the CDC and anything like that. But as far as I understand, fellowships are still open and there's still great opportunities. Even outside of the CDC, the APHL, Association of Public Health Laboratories, they run fellowships also in conjunction with CDC, in addition to local, state, territorial public health laboratories, especially for new graduates and students. That's what I would most recommend, is going those routes if you wanted to go into, a CDC lab or something like that. Thanks, Debbie. That's perfect. Yeah, I think Debbie just posted a link to the APHL fellowships there. And I have one on my slide as well that I would really recommend looking out, checking out. The APHL ones are really interesting as well because they are fairly diverse. You can really look into those fellowships and see, is there one that really is intriguing to you? Not just a microbiology or infectious disease, but there's ones in, I think there's administrative one, and I think there's one in bioinformatics as well that are both, really fascinating and would be really interesting as well. That's where my recommendation would be. And then for doctoral candidates or who are interested in the public health laboratory side of things, I definitely recommend the Laboratory Leadership Service. This has been an incredible fellowship. I think most people know of EIS. That's generally our, big sister fellowship. 70 years, right? They've got a long-standing, reputation for how good they are. But we are the laboratory side of EIS. We get very similar training. We work very closely with EIS fellows, officers, I guess, and yeah, it's been a great experience. I highly recommend it.
Yeah, that's been my understanding too. Again, in academia, I actually have students who have completed CDC fellowships after graduating. So I'm a big proponent of that. As all of you have said, there are also opportunities across FDA, NIH, CDC, APHL. They're just, I think part of it again is understanding those opportunities. And again, I think the value of these webinars is that you get to see and meet, real live scientists that have started probably where you were at, a bachelor's level, maybe an associate's degree level, and you can kind of see that pathway. One great quote I recently seen at a conference was, you have to see the person in that career path to be that person. So I think for students, having those role models and seeing all of you and your background and your pathways are so important as you kind of think about that. So we're getting close to our kind of the end of our time, but I thought I'd just throw this out there and see if any of you have maybe a quick comment about, aside from, the recent COVID experience, can you share an instance, like pinpoint an instance where you were faced with a really challenging circumstance or a practice setting and how you kind of overcame that? I know that's a big question, but do you have any kind of sharp, quick comments around that particular question? Maybe we can start with Mary.
I guess COVID is the one that comes to mind for me. I'm going to break the rule and maybe talk about that one a little bit, if you don't mind. I have all these folders on my computer that are just called coronavirus, because before it had a name, we had to figure out how to make a test for it. And before you have a sample, it's really hard to make a test. And so my job is trying to find samples and help us build the best possible test, because it had to last. We didn't know how long this outbreak was going to be, and then it turned into a pandemic. So with all of these unknowns, I would say that the best thing that helped me was to just accept that you're not going to know everything. You're not going to be able to fix everything. But if you ask people for help, they will help you. And not trying to go everything alone, I think, is the best thing to help in any kind of challenging situation.
Yeah, I think that's great advice across all of those, whether it's COVID or Ebola or measles. I'm dealing with that right now in Texas as well. It's kind of popping up around the country. Any other thoughts from anyone about, some particular piece of your career that you had to overcome a massive challenge that you weren't prepared for?
I'm happy to throw my hat in on this one as well. As I kind of alluded to, or maybe plainly stated during my time, a lot of what I do is forming partnerships and agreements, um, and those are never easy, right? Partnerships, at least from my standpoint. And I recall establishing a partnership that had a history. Let's just say it had a history. So it just in any partnership, you're juggling between your entity's perspective and the other entity, your partner's perspective as well. And there's personalities on both sides. So I vividly recall leading a meeting or amongst a series of meetings that wasn't going very well, and it was going quite south actually. And my supervisor was actually a part of the meeting, and I can tell that it wasn't going well because he was turning red. So that's never a good sign. So as we wrap up the meeting, I guess uninformedly, told a dad joke, trying to cut the tension here. And it's hard to read a room when it's a virtual room, right? I can't see most of you guys' faces other than Dr. Rhoda here. I just know it didn't go well. Even the dad joke didn't land. Didn't even get a fake chuckle. So, but that was overcome Obviously, this is a foreign partnership. It's not a one-off, right? It's a long term. It's a path. So overcoming that came with credibility and shared interest. So reaching out to each other, the individuals that that are involved in these conversations, and again on an individual um, basis, letting them know where you stand, that you have a shared interest and shared priorities, and then ensuring that that you will they will be included in this. And I'll share some feedback that I got from some of the folks that I know that had strong opinions. And when I reached out afterwards, after it was all said and done, and they said two of your strengths are ensuring everyone is represented in our firm's work that you lead. You are very easy to work with, reliable and approachable, which is critical to getting the work done. So that resonated with me. It comes, very strong when the person has critical thoughts and ideas, and has been, maybe, not the easiest to work with, or for their own reasons and passion. So just coming that with, connecting credibility and shared interests.
Yeah, I think that's a lesson that comes obviously for all of us sometimes with time. I know as a parent and as a professor, one of the most important kind of things I often talk with my students about is at the end of the day, and Colonel Conroe kind of talked about this. At the end of the day, it's really about communication, whether it's emails, electronic Zoom world that we're in now, or person to person. And listening and communicating solves 95% of my problems if I can make that happen. So again, I want to thank all of the hosts today. I'm sorry, all of the speakers today. Fantastic conversation as we kind of wrap up. And we'd like to remind everyone that our final webinar in the series will be on July 9th. This session will be in two parts. The first will focus on international scientists. That should be really fun, who have navigated transitions to the U.S. lab workforce. And the second part will feature a short primer on immigration processes and policies supporting those career transitions. So that'll be something to look forward to on July 9th again. With that, we'd like to thank you all, especially our speakers, but also our audience who continues to participate. Please share these opportunities with your colleagues and friends. And coming to today's webinar, and we encourage you to visit our site where you'll find more information on all of these opportunities at supportcdc1lab.org. Thank you all, and we look forward to seeing you on July 9th. Take care. Have a great day.